all in. First of all, I don't even know who I would call to ask that. I'd eventually get to the point where the pain was so good, I'd go in, I gotta go in and have the surgery, and then I get the 9 bills, you know, and I have to, and I'm an engineer, I'm good at spreadsheets, so I put all that in a spreadsheet, and I then look at my entry-level manufacturing guy without a college degree who is never gonna make heads and tails of that. Doesn't know how to read the benefit statement, has, you know, they're gonna trust whatever anybody tells them to do, even if it's the guy next to them that they just met on the floor. So I think that it is so convoluted and so hard to understand what you should be paying and what you're going to be paying, unlike anything else we have to deal with. So I know that's not a small thing, you know, because it seems like everybody's got reasons why they can't do that, but it's very, very frustrating as a consumer.
Laurel, do you want to comment on that as well?
No, I mean, I think transparency is a big part of it, and just from my own perspective, what I see, what has worked in different markets, I think is opening up this conversation between the buyers, the purchasers of healthcare, and those that deliver healthcare, which seems to be a conversation that's been largely missing in this community. I would add that.
Great. David?
I actually wanted to ask a version of Don's question to Laurel, which is, as you look around at the cities where you mentioned, what's been the most successful intervention that employers have made? Let's just take it on the cost front, so I understand the wellness front and all sorts of issues there. What's been the most successful on the cost front, and what would you then say, okay, if something like this were happening in Boston or Massachusetts, here's what I would recommend that they do?
Yeah, the most successful has been a version of what I've just said. The most successful has been when businesses that are purchasing healthcare buy directly to for services from the healthcare delivery system. They create their own network. They put in performance guarantees. They negotiate the pricing, and they manage it themselves in a way that delivers the value that they're looking for. I mean, and we haven't done this in New York. I mean, these are small communities. I think of Savannah, I think of Wisconsin, you know, I think of places like that where they get real value for the healthcare dollars, and the employer can press them on performance, press them on price, and that's where I've seen it actually work the best. In larger markets like this, I would recommend taking some baby steps. You know, to be honest, we actually tried to get a group of employers in this market to go directly to the hospitals and the health systems, essentially send an RFP to all the health systems in this market. These are the 5 employers, give us your best price. And we spent about a year talking about that and thinking about it and going through it. So it's not that we haven't tried here, but at the end, the employers, I think, got cold feet. You know, we had someone that transitioned to a new role, you know what that happens when people move around. But I think the biggest thing was that they got cold feet. They do business with the hospitals, and they didn't know what was going to happen when, you know, this hospital got an RFP with my name on it. So where I think a community like Massachusetts and Boston should start is smaller, right? But let's take a specific procedure, a specific service, and have the employers work with the hospitals on that. And I've been working with the Health Policy Commission to possibly have an initiative around reducing C-sections. You know, I think that's something that we can all agree on to some extent, and let's see if we can have an impact in on something small to start together, and then maybe we can build that out. We saw Pacific Business Group on Health did this in California. They were able to reduce C-section rates, unnecessary C-section rates, and save money. And it was the employers that drove it. So I would recommend starting small in a market like this.
Yeah, Marty?
Not a question, but just a comment. I too am a small employer. I am the HR person. Our rates are about $24,000 per family. And I want to point out that this is an issue in the nonprofit community as well. And so when we think about this from a small business perspective, we need to think about that sector as well, because a lot of those costs are also being driven in terms by the state, or costs are reimbursed by the state. So just something we should consider.
David?
Thank you. Pat, you mentioned in your opening remarks that you're kind of shifting your focus from kind of a wellness to a more well-being initiative and addressing some other factors going on in employees' lives. Curious to hear a little bit more about that shift, what drove that change, and what you're expecting to do with that.
Well, I think the first thing that drove it was we started to see that a lot of our employees were suffering under financial stress, that many of them were living beyond their means. We make good incomes, but there were some struggles. So we started to introduce some financial well-being type of programs, and we're going to take that to the next level. We also, increasing the social dynamic, enjoying the place that you work and trying to work on some of the interpersonal challenges, conflict resolution, all those things that just kind of sometimes can get in the way of enjoying coming to work every day. So those were the things that we were looking at. So we're now working on building some more programs around that. We have been very focused on nutrition, physical exercise, and that's how we've driven the participation rate up to 75%. But we wanted to round it out a bit.
Can I just add, wish we would do that in middle schools and high schools and teach people before they even were treated.
One follow-up question. We've talked a lot today around consumers doing shopping or price comparisons. Here in Massachusetts, the health plans all are required to have websites where members can go online and compare and shop. Probably more of an anecdotal response to this, but do you have a sense that your employees are actively shopping on these websites, know about them, are engaging with them?
We when that first rolled out, actually during our annual enrollment, I explained that. We actually demoed the one for our health insurance plan. The problem is what was happening is people were going in there on pretty straightforward procedures and getting no data. One of the things, for instance, the orthopedics in our town were not showing up with any of their data because of the way they were coded in the system. So if you wanted to, I want to go get my knee replaced, where could I go? It would tell you nobody in Berkshire County does knee replacements. But I know because that doctor just told me to go get a knee, he'll do it. But so what happened then is we stumbled early. So once we did that and people started to going in, and the first couple of times they used it, they didn't get information that was useful. They stopped. And so I would say we probably have very, very few people that are using it at all. But I heard more from the people that tried to and found problems.
Maybe one more question, Ron?
Here's a question on high deductible policies. Firms are trying to move more healthy folks into high deductible policies. We have in Massachusetts, 20% of the population is in high deductible policies. But when I talk to folks on the business side, they have problems moving, getting their employee population to move to a high deductible plan. Is it because they really don't understand the potential benefits of a high deductible plan? What do you folks see?
Yeah, so I think that there is a communication issue. I think that employees don't often understand what it means to be in a high deductible plan. I think they don't understand the benefits. I mean, I think they see up front the big negatives, but don't understand potentially the possible savings vehicle and the benefits that could accrue if they go into a high deductible plan. So I think that's a big part of it. I do think that employers are starting to see that maybe high deductible plans are not the best thing because people then start to avoid care. And we're seeing that now that many of our members have had them in for a period of time. Most of them have not. Some have done a total replacement. You don't have a choice. You have a high deductible plan. Most are doing it as a choice and are seeing the negative consequences of that and are starting to rethink some of those strategies. Not so much around the plan design, but about how do I double down to get my employees engaged in their health care since they do have a high deductible this way.
The problem that we have more is lining up the right people that it makes sense for. And this is where I struggle at a certain point becoming a little too paternalistic or maternalistic. People will trust what I tell them, and I want to be careful that I don't direct somebody, down by being too specific. Oh, maybe you should try this. So what we're trying to do this year is really we're going to do an extra education piece on the health savings accounts, and we've had a high deductible option. They've not forced everybody to that, but this year we're going to actually offer one that has a much higher deductible that will really lower the premiums. I think it's going to be perfect for a lot of our young people And we're gonna seed the HSA, because that's the biggest problem, is that first year where you go for your first prescription, and all along you've been paying $15, and now all of a sudden you're paying $85 for it. And even though you told them to, and you did everything you could to prep them for that, that's a shock. If it comes on a week that they're a little tight on money, that's a bad thing. And so we are concerned about people that shouldn't be in those programs because they are higher cost, and they'll stop going to get the medical care they need, and maybe try to get more of our young, healthy folks into that and building that HSA up over years so that it will be available when they
We'll
need
give
it.
the last question to Secretary Sutters before we break for lunch.
Great, I'm standing between all of us and lunch.
Who could do a better job on that?
It's really more a comment than a question. So one, I want to thank Pat for obviously being completely committed to having a healthy workforce. This is a really significant issue for the Commonwealth of Massachusetts because the backbone of employment in Massachusetts is small business. And we've now heard from 3 small businesses of $24,000 for coverage for a family of 4. I worry because I've seen the commercial crowd out, it's my term, from commercial to the Medicaid program, which is the biggest driver of the Medicaid program is in fact enrollment. And I hope that your insurer has told you why you're getting the 20% increase and is giving you the data, because you're doing all the things right that we would expect of our employer partners in this, which is you're committed to your employees' health, you're engaged as a businessman and businesswoman into health benefits, seeding HSAs and the like, and I don't know what else you can do except sort of cherry pick who you hire, which you would never do, obviously. And I just want to leave it at that, Stuart, because this is the conundrum. I applaud what you're doing for the big companies, but the backbone of Massachusetts is the small employment. And we have to do something different when if the average cost increase for insurer is 6.7%, why is the company who's doing the right thing in Western Mass getting a 20% increase?
I couldn't agree more. So we're going to leave that question hanging, but we're not going to leave it hanging because I think it's something we need to come back to. So I want to thank Ron and Rick, and particularly I want to thank our panel. This was a wonderful panel. Thank you so much. For lunch, we ask everyone to be back in their seats by 2 o'clock, and we will continue.
I'm just going to grab some, maybe right back.